Now, there are two types of procedures that are done for blood vessel diseases. Okay, one is angiography, the other one is what? Angioplasty. Okay, so most of the times you will hear them, they are like talking about them together. So it's good for us to shed more light on these procedures. Okay, so angioplasty and angiography is as follows. So they're actually two closely related procedures, right? So they are used to diagnose and also treat blood vessel disease, especially any blood vessel disease that is causing narrowing or blockage in the blood vessel. Okay, so you see buildup of what? Fat, buildup of fat on the walls of the blood vessel, and it's reducing the space in which the blood should pass. So you got that. So angiography, you see that it's a diagnostic test and it uses X-rays and contrast dye. I don't know if I didn't actually bring a picture, okay, but this is angiography, but it's not showing the imaging. Do you understand? So it's supposed to be imaged. So with that imaging, you can get to know if the blood vessel was narrowed, if it was blocked, or if there was an aneurysm or malformation. So it's commonly used for coronary arteries, arteries in the kidneys, cerebral vessels, and also peripheral arteries. So procedure, a catheter is inserted through the femoral or radial artery. So they'll inject the contrast dye there. Then when they take X-rays, the the place should be much more clearer. The blood vessels should be much more clearer. So to provide detailed anatomical information, then from there you can now be able to know which type of treatments to administer to such a patient. So bleeding is common, and sometimes the patient could actually react to the dye you put. Okay, so you have to always make sure that they are not allergic to it. And kidney injuries, that's if the dye kind of like stresses the kidneys too much. Then how about angioplasty? This is it. Okay, so it's just a therapeutic procedure, and if the blood vessel was blocked or narrowed, I'll now do this procedure so that what I'll chop off anything that was narrowing the space or blocking the space. So I have different types. It should be a balloon angioplasty. So I have balloon angioplasty and I also have the stent placement. Stent placement is like I'll just come and drop the stent. This one is balloon, this one is stent. Are you seeing the two different type of angioplasty? So purpose is to keep the place wide so that blood can still flow, to relieve the symptoms that the person was facing, chest pains, leg pain, resistant hypertension, and also prevent any other complications that could occur, like heart attack, stroke, or kidney failure. So it's often performed immediately after angioplasty if a blockage is found. Advantages is less invasive. There's a short recovery time. Okay. So sometimes the narrowing could come back again. So they call that a re-stenosis. So you have to always do it very well. So that's it for what we have for angiography and also angioplasty.